Good afternoon, everyone from India, and welcome to GANSID First International Congress. And this particular session is for Asia Pacific. And I could see participants joining slowly. There are parallel sessions happening for other regions as well. So some of your other colleagues might have joined those sessions, because I got few messages from somebody that once you land on the landing page of GANSID, you see a lot of other parallel sessions happening. So please feel free to message your teammates if they're struggling to come to this particular room. They have to identify the Asia Pacific session, and there you will see Vinitaji's name and my name, and then people have to log into this session. So nevertheless, we will start. My name is Prabhat, and I'm based out of Mumbai in Delhi, and Vinitaji is in Delhi. Currently, I work with a pharmaceutical group called Boehringer Ingelheim as a director for government and public affairs. But I've been working with, especially for blood cancer and hemoglobinopathies for last few years, and got an opportunity to work closely with few of the very capable and passionate patient leaders to understand this space a little bit. Along with me, I have a privilege of hosting Vinita Srivastava ma'am. And I think those who have joined from India, she doesn't need any introduction, but for the interest of some of the participants who may not be from India, I will request Vinita ji to introduce herself and also thank her for sparing her time for this session. So over to you, Vinita ji.
Thanks, Prabhat. Thank you so much. And it is nice to join GANSID. Actually, it's again a learning for me, because I'm going to learn from the patient groups and others as well. Because now the importance is that India has come up with so many good things like sickle cell mission, and also interventions for hemophilia and thalassemia, which is all credits to our Honorable Prime Minister and our current Minister of Tribal Affairs, who has really worked hard for getting sickle cell mission into the country. However, important is that until unless all the working groups join together hands for this cause of blood disorders will not be possible. So with this, I would like that Prabhat can take over and tell us what exactly we have to start with. And he's the moderator for us.
Sure. Thank you so much, Vinitaji. And you have been very moderate, saying, a lot of things happening in the government sector. But I think every place, you need a catalyst. And that catalyst actually makes the system move. And you have played that role, especially in hemoglobinopathy. And for years, we have seen that you have been after the system, not only the health system, but also other systems to make this program run. And we all will have privilege to, again, kind of learn from you that how this whole journey is going and what is in store for us in future. I could see now participants joining. It's a festival day, so I know many of you would be out, but thank you so much for all of you who are here. We have time for almost till 2:30, 3:30, 4 o'clock. We have ample time, and let's make this whole next 1.5 hour more of a kind of a discussion form. There will be a few presentations from our side, but please feel free to chat, put your message on the chat. But before I start, if I can ask people who are on the call, unmute yourself and just very briefly tell your name, the disease area where you work, and what any organization you are associated with. You can just introduce yourself so that everybody knows you. Just to facilitate, I see some names, so I'll just call out the people. There are a few unknowns, so I see Shobhaji, your name on top. If you can just introduce yourself, please.
Okay, I'm Shobha Tulli from New Delhi, India, and I happen to be the Secretary of Thalassemics India, which is an NGO established in 1986, and then I happen to be the Vice President of Thalassemia International Federation, holding the post of Vice President since 1994. Then I am also the President of Federation of Indian Thalassemics since 2000. So thalassemia is my passion, and I have the opportunity to work at the grassroots levels knowing the pulse of the patients as well as the parents as well. And I think this introduction is quite enough, for today's session. And I hope to participate in this Congress. And I'm very pleased, I must add it, that I'm very pleased that I'm getting this opportunity to be a part of this session, and which is the GANSID Congress and 2023. And I have heard a lot about this, and I hope that this will lead us to come up with some more knowledge and more information, and maybe the solutions, that we are looking forward in the field of hemoglobinopathies. Thank you, Prabhat.
Thank you. Thank you so much, Shobhaji, for your introduction. And let's make this next few minutes and half an hour almost when we'll have a kind of a discussion and also a voice from India, especially as part of South Asia. We have to be a little bit more louder in the coming months and years on this platform. So thank you so much for sparing your time. I see Abdul Mazid. Abdul, if you can introduce yourself, please. Abdul, if you can unmute your mic and introduce yourself. Okay, by the time Abdul, yeah. Yeah, Abdul, you can speak. I see you have unmuted yourself. Okay, I think there's some issue. I see Gautam Dongre. Gautamji, if you can introduce yourself, please.
Yeah, thank you so much, sir. And first of all, congratulations to all of you. And I must thanks to GANSID for giving me the opportunity to speak. And here, Vinita Srivastava ma'am and Prabhat sir, thank you so much for giving this opportunity. I am Gautam Dongre from National Alliance Sickle Cell Disease Organization, NESCO, which is the organization of the organization and working for the sickle cell patients welfare in India since the last 4 years. And also I am a board member of a Global Alliance of Sickle Cell Disease Organization, GASDO. And we all are working for the sickle cell disease, especially in all over the world, for the advocacy and welfare of the society. So I must thanks to the GANSID for this beautiful session, because there is Vinita Srivastava ma'am, who is the main leading person who made change in a sickle cell disease area in all over India. And we must thanks to Prabhat sir for suggestion to be the people who were struggling for the sickle cell disease advocacy. So this is a very good session. We are very fortunate to learn again from both of you. Thank you so much.
Thank you, Gautamji. Abdul Mazid ji, will you be able to speak now? If you can just try once more.
Yes, sir. Hello, everybody. My name is Abdul Majid, and I am the operation head for one French organization named IGAS. So we are dealing with these equipments which provide the safe blood to the sickle cell and hemoglobinopathies patients. So our products we are associated with NHM as well. So we are working for the facilitation of the safe blood transfusion of the patients. That's
yeah. Great. Thank you. Thank you for joining. Lalit Kishore Pargiji.
Thank you, sir, for giving me opportunity. My name is Lalit Kishore Pargi. I am sickle cell warrior. I am an executive member of National Alliance of Sickle Cell Organization, NASCO, and founder of Sickle Cell Section Rajasthan Foundation, Sickle Cell Section Rajasthan Foundation. We are working Rajasthan, and also I am a nursing in charge of Center of Excellence for Sickle Cell Disease, Udaipur. Thank you for giving me this opportunity.
Thank you, Lalitji, for joining. You are doing some very good work in Rajasthan. Manoj Rupaniji.
Hello, everyone. I am Manoj Rupani from Hyderabad, India. Sir, I'm working as a founder member and treasurer of Thalassemia and Sickle Cell Society in Hyderabad, which was formed in the year 1998. This is the Silver Jubilee year, 25th year. And we are, in fact, the India's biggest society that is working. We have about 3,800 children, thalassemia major we are treating. And we are working for the welfare of the society since past 25 years. Thank you so much.
Thank you, Manojji. I also see one more attendee as unknown. If you can just unmute yourself and introduce yourself, please. Okay.
We have Dr. Neeta Munshi also. We can ask her to give her Dr. Neeta Munshi.
Okay. Dr. Neeta, I think she would be with this name. Ma'am, if you can introduce yourself, unmute your microphone and system. Okay. So maybe whenever anybody who have not introduced will come back again after half an hour or so, and we will again introduce. So just to set up a context, just give me a second. Now, before I start, as I said, 2-3 basic rules. Whenever somebody is speaking, if you have any questions, see, this is a session for us now together as a team from India, because we don't have any people as of now from other countries. So from India, let's kind of discuss some of the good things that has happened in our country, because this whole session is being recorded as well. And a lot, I think the other countries can learn now from India. The way thalassemia, hemophilia, and now sickle cell disease as a program has evolved in this country. I think many other regions actually who are currently doing a kind of a session like we are doing, I think now India has a lot to offer to them. We have been learning from other countries, but I think a country of our scale, with so many, India is always seen as a country of country, and how these programs are being implemented, and also program like sickle cell disease, where we have a target of eliminating sickle cell disease when we become as a country of 50 years. So I think these are very important aspects. So please feel free to chat. Now, all of you have a chat window with you. Before starting, if I ask you to write one word what you feel today about whatever disease you represent, one word which comes to your mind about, let's say, sickle cell disease, thalassemia, or hemophilia, about the overall situation of the patients or the program, what is that one word that comes to your mind? If you can just chat on your chat window, one word. One word that comes to your mind when you think about, let's say, thalassemia or sickle cell disease or hemophilia. Okay, keep thinking. Whenever you feel that, yes. So I see one line, sickle cell free India. That is one word that is coming to NASCO team. Gautamji, thank you for writing. Other members, if you can just put one word. Shobhaji writes patient care, very important. Any other individual? In your chat box, you will see a window. Type your message there. What is on top of your mind when we start having a conversation? Pain, not again, we have to work on. Okay. Thalassemia Mukt Bharat. So one thing I think is coming up with prevention. Very good. I think we have one or two more people. No problem. Now, can you see my screen now? Anybody can confirm? Because
Yes,
I cannot see. Yeah, okay.
Yes, sir.
So now what we are going to talk today, the session that the topic what we have been given is benefits of cross-stakeholder collaboration when it comes to hereditary blood disorder, and especially how pharma, healthcare providers and patient community can work together. I have not more than 3 to 4 slides just to kind of ignite a discussion, and then you will see live example from Vinita ji when we talk about it. Now, and these are not anything new. All of you are so experienced in this field, you know, you deal with it every day. But again, few thoughts just to ignite your mind is when we talk about stakeholders, I always say that do we recognize or acknowledge our relevant stakeholders? There is no yes or no answer, but it's a question. When we think about stakeholders, we always feel that who could be a stakeholder, but we may not know. There could be stakeholders whom we don't know. But those individuals or organizations may have a stake. Now, just for an example, since I see group from thalassemia and sickle cell disease, if I can ask, let's say, Shobhaji, for you to speak and say that who are some, if I ask you to list 5 stakeholders, who would be those stakeholders for thalassemia community in India?
Well, I think that if you're asking me to name 5 stakeholders, so I think the first is that in order to convince, the stakeholders, one is, of course, the patient community, and then is the government authorities.
Government.
That's another, and the third is, of course, the pharma companies also, because we need their help. So these are the straightway, and then of course is top of that is the NGO caregiving bodies.
Okay.
So these are the 4 stakeholders I could think of.
Okay. Gautamji, if I ask you, what comes to your mind when you think about relevant stakeholders from sickle cell disease perspective? And Lalitji also, please free to add to this.
Yes, sir. Government, number one, government officials, like we have to sensitize the ministers. So ministers are really very a big stakeholder for us.
Okay.
Executive persons, like those who implement these policies for the nation. So second, they are the big stakeholders for us. Third, pharma industry, and which is very important. And fourth, I would like to the NGOs, those who are working for the sickle cell disease. And fifth, I would like to add that the person who is not related to the disease, but those who can support for this type of disease by heart. So these type of 5 stakeholder I must point.
Okay.
Thank you, sir.
Anybody in the group, apart from the stakeholders, what has been kind of enumerated by Shobhaji and Gautamji, any stakeholder that you feel that we are missing? Manojji?
Sir, personally, I feel even the gynae should be one of the most important stakeholders, because that is the starting point where they can.
Okay. So understood. Gynecologist. What else?
Yes. And then again, the ministry, sir. Government is also a part of it.
Yeah. Okay. So good. So, now in a country like us, where, there is so much of interrelation, we have multiple stakeholders, and you all have identified the top stakeholders now, and these stakeholders keep changing as a health system we evolve. Insurers may come, National Health Authority may come, tomorrow a crowdfunding platform may come. So, the whole what I wanted from this slide is to recognize, identify, and keep recognizing the new stakeholders and make a connection. Many times what happens that we miss out some stakeholders, or we reach out or make connection with these stakeholders at a later point. Now, if we talk about collaboration, now collaboration I think is one of the most abused word. हम बहुत use करते हैं collaboration, but collaboration is truly an art and a science. This is not easy, because it looks easy, but collaboration is very difficult. And people who have been running an alliance or a federation, they know how difficult or how easy is this. But because of their experience, expertise, or many other things, they could actually navigate through this whole process of collaboration. So always, those who are on the call, we all know, I need not to re-emphasize, but collaboration is truly an art. When I say art, it's how you manage, but it also has science. Why I say always collaboration is a science, because there are certain very basic things which you cannot overlook. And that has to be done in a very structured manner to kind of ensure that what we achieve through collaboration. And I always say that collaboration is to make an elephant move. Elephant doesn't move very easily. You really have to make effort to make it move. Collaboration is something like that. And you will hear when Vinita ji will talk about her many examples. It's like making an elephant move. This elephant has not moved with one department. It has not moved with one person. But as an individual, she would have actually ensured that collaboration between many individuals within a particular ministry or sometime beyond a ministry to make this elephant move. And when this elephant moves by even one step, it actually leaves that impact on ground. And that is why collaboration is important. We all discussed that, yes, government, healthcare professionals, pharma, all these people are important. And there are many, including media, payer, insurance. There could be, we can go on listing and listing. But what I always say is what is important, what is at center is the patients or caregivers. Many times everybody talks about patient centricity, but I always say that it should not happen that you leave patient at center and then everybody revolves around. Patients have to be connected. Patient has to be engaged. And that is how in our country, we have seen how, for example, especially in hemoglobinopathy, government has been very, very open to collaborate with patients. Whether it's the first guideline that came from ministry, there were people from patient community part of development of that guideline. Or when a mission on sickle cell disease was launched, several consultations that happened where patient or patient community has been engaged. Similarly, in hemophilia and other blood disorder. So even government has come forward and have started kind of involving and engaging patients. Same with many of the pharma companies, where they have also started listening to patients, understand their pain points, and to come up with solutions what could be more tailor-made for them. Similarly, healthcare professionals. We are blessed in our country. We have many healthcare professionals who really understand the pain of especially people who are living with hemoglobinopathies. And the kind of partnership that we see from these very passionate, compassionate doctors and patient community is something which you may not see in many other disease area. And there is a lot, and similarly, there are many other stakeholders. But for today's discussion, we have kept these three stakeholders as our key pillar. Now, as I said, that collaboration, there are certain signs that makes collaboration work. Always, and these are again not new things, we all know about it. But just to reiterate, one of the most important thing is mutual trust, without which no collaboration works. Either in a workspace, in any, or even at our home, in our own personal life. These 5 things always works. Trust, respect to each other, team, a kind of a feeling of a team, always keeping team ahead of our individual, acknowledgement of different members of that alliance, collaboration, and then recognize the people who are making efforts in this. So and there could be, many more ingredient, but these could be the 5 key things what I have learned in my experience in last 23 years. The other thing which is also important is this whole collaboration has to go beyond sectors and borders. In a country like us, the borders may be beyond states. Sector may be, let's say, how thalassemia, hemophilia, and sickle cell disease are working together. How different ministries are working together. And again, you will hear more as an example from Vinita ji when she speaks. So remember that the collaboration has to cross border. It has to cross sectors as well. I will pause my share, right? And what I'll request now, Vinita ji, to share about a very fantastic presentation she has worked on, where she will take you, how this whole thing started and where we are. And then once we hear from her, then let's go for a kind of a conversation, a kind of a discussion. So over to you, Vinita ji.
Thank you, Prabhat. It was nice. And it is really nice to hear everybody, because we in India, we understand each other, and we were able to do this program, whatever been done in the country, because of everybody's help. It is not an individual, not even the ministry, but everybody has joined together. As you said, that it is a collaboration. And it was a collaborative efforts of the patient organizations, the government, every ministry, I should say. It's not only Ministry of Health, but other ministries also joined hand for the same. And the corporates and everybody worked together to come up with certain guidelines which were essential for the country. So the best part is we have learned a lot. And these learnings, how we are going to translate into implementation is a big challenge. So let's start with the things. Say, it's a transforming lives of person living with blood disorder, a multi-sectoral approach, what just Prabhat was talking about, that it is not one individual, but everybody has been involved while defining the strategies. So it's basically in blood disorder, India has the largest big cohort globally with 27 million new births in 2010. And the country has the second largest global population and 1.2 billion and a high birth rate of 21.8. So it's important why I'm talking about this slide, because we need to have a good analysis while we start our services. Why I'm saying services, we started our intervention in 2013-14, and this was the basis, because we cannot do any intervention without the evidence. And this was the evidence when we started with the interventions. Genetic disorders arise in the population through spontaneous mutations and through affected births in families with known risk of genetic disorders. In absolute number, the birth prevalence of genetic disorders is likely to be high in India. And you can see even in the sickle cell disease, we say the southern parts have more, Africa has more, but when I see the incidences in India itself, only in India is pretty high. So thus, the blood disorder places a great burden on healthcare services. And you can see the basically the map, which talks about how India is being affected with these disorders. Next, please. So in India, a case of high burden of disease, which is thalassemia, sickle cell, and hemophilia. So you can see that 10 to 15,000 births are every year they are born in India. Sickle cell is 1.5 million warriors. That in 15 lakhs, we have people with sickle cell disease, and hemophilia also we have the 100K people with hemophilia. But still, the issue is that we haven't done the intervention in a place where we can actually say these words, that these are the numbers. So now with the sickle cell commission coming in, we can also have the disease burden exactly. So what I have seen in other countries also, it's only a small data which just is taken as a cohort, and on that basis we start talking about. But in India like country, where we have a central belt full of these diseases, and when we started going to the southern part of India, we found the diseases also prevalent over there. So all these things makes a lot of difference. While we talk only about that, we had one Jan Vigyan project by ICMR. It was a small cohort. We talked about that maybe but actual numbers are very different. So the government, after seeing these, and we also had one good screening done in 2014-15, which I haven't written over here. We basically 10 million people were screened. And you will not imagine we could find 47,000 disease patients with sickle cell disease. So that was evidence-based data. And we came up with some interventions because of these evidence-based data. Next, please. So health in India is a state subject. It's basically we have states where the state health policies are there. The government of India also take up the initiatives, but health is a state subject. We formulate the policy, but the implementation is with the states. So federal level policies are formulated and execution is done at states. Why it has been written, right? The thing is that we formulate at the government of India, but the implementation plans has been done by the states. States are the basic nodal agencies for the health and other things also. So the collaboration and other part has also to be done at the national as well as at the state level. The same corner has to work. And this we need people from the government sector and every part of it where they have to work with all these frameworks to get the policies and the implementation plans implemented. So community-wise, incidence varies in thalassemia. We all understand because if you see in Sindhis, Punjabis, there are much of the incidence. But in some of the communities, less. But it's not because what is happening? The migration is happening. So from one part of the country, the people are going to the other part of the country, which is why this thalassemia is also being carried out, or these diseases are also being carried out. So mutations is getting varied. So it has a wide expanded versions. Now we cannot say it is only in some of the specific places. It's been getting wide. So geographical area, if you see in the sickle cell disease, it is in central belt. It is in eastern belt. Now you can find it in southern belt also. And very strange, we were just looking at this belt of Uttar Pradesh, Bihar, which is unknown for sickle cell, but we could find the cases now. And because the screening as per is not done as per the norms, while we were doing the screening, we are finding the number of cases are increasing. So these are the challenges which we are finding while we have come up with a mission, but now the work plan has to be reorganized regularly while we come up with the new incidences. Next, please. Now, impact on health systems, as I talked about, we also did the health economics. Why we are talking about prevention, which is very important. When you see the health system impact, is India cost of transfusion chelating of 30 kg body weight child is 1 year estimated as 2 lakh, though the government is doing. But yet, we have to understand that what is our per capita income? Just 1.43 lakhs. And the cost of estimation, which is, a burden to a patient. I should not say burden, but expenses are expenses. So 2 lakhs for 1 year is a huge amount. And the children who suffered, the sufferings are another huge mental trauma which they have to suffer. Is not only the patients, but their parents also suffer in the same amount. And it's not only the patient and parent, but the whole society is getting impacted. So once we say this only one child, no, it's not one child, rather the whole society is impacted somewhere or the other. With an estimated of 12,000 births with thalassemia measured every year, average survival is of 50 years. We have around 5 lakh affected children. Now what? Just imagine. If we have this number, what is going to happen? The health system has to collapse if we don't take care of the prevention. So now the concern and the government is taking up that we really have to work for prevention, which is going to help us in a better way. So same way, cost of managing 5 lakh children works out to be 10,000 crores and rupees 100 crores if only one has to survive. That is Roshan Kola, one of our scientists and an eminent doctor. The cost is approximately the same in South Asian countries. So if you see the South Asian countries, the cost is raised. So now in India, we have basically estimated around 1 lakh children with thalassemia, but the cost is huge. The government has taken up the initiative to treat these children, but that is not sufficient. Next, please. So just now we talk about, you can see these slides and just guess out how much is the burden to the government sector also. And why the screening is important. Why the pre-screening is important rather going for prenatal genetic or but CBC and HPLC or the new tests like we have point of care test with us. So all these tests are better tests. To now, if you can see the government of India's endeavors, there are 6, 7 sickle tests are there. Now, apart from HPLC, also we have much over like small point of care machines, which are working very good in the peripheries. You can take them to the remotest area to get the people screened. So this screening is much better than what we are going to invest on the treatment and cost, because we don't want to increase the disease burden in our country. We want to reduce down. And our target is to reduce down by 2047. That is a target given by our Honorable Prime Minister. He says by 2047, there should be no child born with these disorders. So this is important for us. Next, please. So what WHO says? So WHO resolution was done. It says, WHO said that now it's a time, in 2006 only, they said that World Health Assembly passed resolutions urging member states to develop, implement and reinforce comprehensive national integrated program for the prevention and management of hemoglobinopathy. The member states were also urged to develop the strengthened medical and genetic services and community education and training. So WHO took the resolution, but in 2006, it's a long back. Now we are in 2003. It's a long back that we took the resolution. But now the time is that we have to start working on the same. It's our time now. Every country who is, especially when we are talking about Southeast Asia, it is our duty to take up these issues that nobody suffers from these problems. We heard many patient organizations just now with us. They said, important is that everybody is free of pain. Just imagine of the pain. And one whosoever, if understand the pain, is a pain crisis or any pain which comes up for these patients, is really, then one can very easily imagine and do the work for these disorders. Now the government, every government, I'm saying, talking about not only the Indian government, the Indian government has taken up these issues in a very efficient manner. And I'm thankful to all, because everybody has worked with me very hard. So I'm thankful to the Indian government, but still we have to go along. But it is now the time that every country should come forward for these work plans. Next, please. So what is important is a multi-pronged approach was required to address the key challenges. Before going for the intervention, we thought that now this is a time, but we have to see whether when we are talking about screening, how we are going to do the management as well. So what was important to us? There were stigmas, there was infrastructure issues, there were issue of funding, there were geographical access challenges, health information, as I said, community context, many things were, and needs for policy. So how to come up with the need for the policy customization?
Now, if you have any question, as I said, kindly put it in the question and answer button. We will answer it later. Now I will move straight.
So need for policy customization was important. So we did the Indian government did a full long multi-pronged approach. It was infrastructure which was taken up. We saw what are the limited functioning of the health facilities, unavailability of medical officers, equipment, drugs, health funding. We saw key government of India is doing it, but because it's a 60-40 share. So how much if government of India is doing, is the government of state governments are putting up their 40%, then how's the utilization is being done? Then we also start off where the people who live in habitations over here in India, you will find these tribal people lives in habitation. There are PVTs, primitive vulnerable tribes. They lives in habitation. 200 people living in one place. So 90% people live in rural areas, mostly in hills and forested, which are very difficult to reach. Again, I said, screening for them, a big challenge. Access to health facilities, a big challenge. So government of India took all these initiatives took all these things in the cognizance while coming up with the policy document. So health information data inaccuracies, as I said, because we didn't have the enough data, but now we have enough data to come up with a policy. Social discrimination is very important. Now stigma. Once a person knows that she or he has a problem, other person goes away from him. If they want to get married, it's very difficult for him. Even the families has to suffer for it. Why discrimination? They're also human beings. They're also patients. They need our support. Rather, we should go forward to get them supported. That's a and the community context. Tribal people believe the lack of trust in government health systems. That was very important. So we also took their headmen, the community people from the community. If we want to hear, then only we are able to do the things. So these things were taken before getting into the policy customization. Next, please. So first strong step was in 2016 when we came up with the hemoglobinopathies guidelines in NHM. And it was a good initiative. We started our guidelines and in 10 months we came up with, but entire country, 32 experts from the entire country. And I'm saying experts, that was government organizations, the social sector, the patient organizations, everybody came forward when we started this. I still remember I was not having a zero fund. I was not having a single penny in NHM to come up with this interventions. It was very difficult, but people from across the country came forward. And I have some people over here who came forward and said, yes, we are going to take out of these issues. And everybody, I mean, the doctors, we have some doctors also over here who came forward. Yes, we are going to design it. This is important to us. And everybody came forward for designing these guidelines. And at NHM in 2016, we came up with the hemoglobinopathies guidelines. It's also an operational guidelines. Next, please. So what is the vision of Indian government? To reduce the prevalence of hemoglobinopathies and to provide affordable and quality healthcare to all the patients with thalassemia, sickle cell disease, and HBE as well. To provide optimal treatment to those affected and prevent to further children with disease and making them lead a better life. So reduce the prevalence of hemoglobinopathies, that means awareness. Most of the things we can make it sure if the awareness is done in a good manner. Now, awareness. I can't say that only health ministry can do awareness, only the travel ministry can do awareness. Everybody has to join hand. So when I started talking about awareness, I spoke to the public Panchayati Raj people. They said, yes, we can go to the grass level. Now the Sarpanch people, they can do a better job what we can do at our level. They are the better people. The Rural Development Ministry, they are again a better people because they are staying with the grassroots people. Education. Now education cannot, I mean, we cannot better imagine without education. So education, all these departments were convergent to, yes, the government took the initiative that now it is a time that we have to put so much of awareness plans. We came up with the awareness modules in the country as well as the counseling modules. I'm not saying only awareness. If awareness is being done, then it is followed by the screening and then by the counseling. That makes a sense. So government of India took the vision that yes, we have to do these things simultaneously. We cannot afford to say that we are going to take up only the awareness in a different manner, but we have to take awareness in a step by step. So awareness, then as I said, screening, and then the counseling. And then, of course, the management comes. We cannot leave people. If we are doing the screening, if we are doing the things, so we cannot leave people. Optimal care, as I said, the management comes here, said we have ICHS centers in the country, so why I said ICHS? Because these centers are meant for hemoglobinopathies and hemophilia both. Now, when we talk about blood disorders, that means inherited blood disorder, that means we need to talk about everything. The centers are meant that every patient who comes to the facilities are being taken care of. Their screening has been done. If they need some MRIs or any screening, other screening is also, that is also been done. And the management part also be. They are given with safe blood. They are provided with basically the drugs which are required. So everything, and make them leave. So rehabilitation is again a challenge to us. We went to MSME and asked them, requested them. That is one ministry to us. We had requested them. Then these patients can get a small amount to run their own businesses because they are talented people. So all these things were taken into consideration while designing our own vision, of which is Government of India's vision. Next, please. Next. So ongoing journey, as I said, release of national guidelines in 2015-16. 15 we started, 16 we started dissemination, dedicating annual budget in 2017, standard treatment protocols in 2018, and national SCD mission as this was launched recently by our Honorable Prime Minister on 1st of July 2023. So this mission was launched. And now we are also looking at that this mission is going to take care of other patients as well in a better way. Next, please. So you can see National Sickle Cell Mission Elimination with the target to eradicate sickle cell disease by 2047, as I had mentioned. And all thanks to our Honorable Prime Minister, as I said, our Tribal Minister, who is Mr. Arjun Munda, and our Health Minister, Mr. Mansukh Mandavia, all of them were together to come up with the mission. It's not an easy job. And the collaborations are not easy. The convergence are not easy, but still everybody came forward. Yes, we want to go ahead. And now this is the time that we have to eradicate the disease. It's not only to lower down the prevalence, but to eradicate the disease. Next, please. This is a step. We came up the prevention and management of elimination of sickle cell disease. If you read this is on the website. This will tell you that how many convergence is important and how this has been done throughout our journey. Next, please. So, as I told you, health promotion awareness, I have already spoken about universal screening and early detection. And this SCD mission has 3 pillars, as I always said. Awareness generation, premarital counseling, universal screening and early detection, management of affected individual primary, secondary, and tertiary care levels, patient support mechanism, and community adoption. So unless community adopts these things, we are not able to progress, whatever we do. So it's important is that everybody comes forward. And these strategic pillars were designed with the efforts of everybody, every ministry, every patient organization, because until as patient organizations join us, it's very difficult for us to reach them. That's what important, and the awareness was initiated. We recently have an awareness kickoff on 28th of August, and now we have master trainers across the country. So these awareness plans, and now again, we are going to have a regional workshops. Will start from November 1st week. So this will create a huge awareness programs across the states. Next, please. You can see that we also came up with the disability certificate. It was for 1 year, which was again for 3 years. Now we are thinking of a permanent disability. And again, credit goes to our Honorable Minister of Tribal Affairs, who is Mr. Arjun Munda. He said, yes, why? Because it's a progressive disease. We need to take care of these patients. And people, earlier also I said that once person understand the pace, he can only initiate the things. It's empathy. It's not sympathy, it's empathy, which works. Next, please. So some of our efforts, we can say financing of hemoglobinopathies beyond Ministry of Health. Now you can see tribal affairs, social justice, Department of Science and Technology, government funds, PMJY, so many things have come to. Now you will see why you're saying the Department of Science and Technology. We are coming up with the gene editing thing. Now imagine, we are talking about the gene editing. So this CRISPR-Cas has come up, and this GST took an initiative that, yes, we are going with this. Ministry of Tribal Affairs has a STC fund, which was given, is given to the ministries. And there they said, yes, we will go for this. So these are the things where we are talking about the government. Universal access to drugs. You can see the iron chelation drugs, hydroxyurea, safe blood, clotting factors are available to the patients in the district hospital, which was a challenge to us. If we talk about 2011-12, which was really a challenge, but now at least our patients are getting, they are happy. We at the government sector, we are happy. National Security Scheme, we recently came with. So again, I'm very happy to say that this is which covers about 50% of the social and economic weaker population, cover SCD, thalassemia package now. Again, a big thing that now this has been covered. And thanks to our again, senior colleagues, everybody who came forward, and the patient organizations who pushed it. Shobhaji is with us. She pushed it up. Yes, we have to go in. So all these things are very important. Convergence with CSIR and DST for sickle cell gene editing, as I said. So we have already done it. Next, please. Some unique public-private partnership. This is a Coal India project, which came up in 2017-18. And this was again an important model, while I'm saying that partnerships are important. Coal India came forward, yes, we will support this bone marrow transplant for thalassemia kids. It was ministries and it was ministry initiated, Ministry of Health initiated, but somehow Coal India came up, pitch in, the patient organization also pitch in, and together efforts, you can see that this is now that the program is on. We have completed so many transplants. Exact number I'm not remembering, but when we initiated, it's a pleasure to initiate all those things. I have been a part of it, so I can understand how enlightened I was when I heard that we have got the project. So these things, this cannot happen as individual. It can only happen when there are partnerships, when there is a convergence, when there is a trust. As Prabhat said, there is a trust, and trust is mutual. Then only it happens. Until the trust is mutual, it is very difficult for us. Next, please. And alone we can do little. Always I say, together we can do so much. And I always say that's important is that everybody needs to join hand. Whosoever has joined today, this is the first step. Now you guys has to take this forward. I'm requesting you again, you all have to take this forward. And because of GANSID, we have come up with this workshop. This is not going to end, but this is an initiation. This is a start, a small start. We have to come up. We all have to join hands in this cause. For this cause, we all have to join hands, and we have to also join GANSID, say, yes, we are together for the world. It's not only the India, but for the world we are together. Thank you so much.
Thank you so much, Vinita ji. I think I could not find even one slide where there was no mention of partnership. There was no mention of collaboration. I think everything what you shared, I think it involved many stakeholders, and that is one core thing from India. I think we are going to share to the other countries, other regions, is that these are tough things, but these tough things can be done if people come together. And I think when you started, it was not many people, but today, the collaboration side, I don't think there is any ministry you have left. I think we have to find ministry who has not been approached, and time will come when many of these ministries who we may see today not that active, but eventually they will also come together on this. So
Prabhat, I would like to tell you about it, that 14 ministries are going to connect with us for this plan for sickle cell disease, as well as now we are also pondering for thalassemia. So this is going to be a great venture for these 14 ministries if they all come together, because it's going to help us a lot.
Brilliant. I think so now I think we have almost 20-25 minutes for a conversation, and as I said, you will say why we are discussing today at this platform. We have many kind of opportunity in India to discuss, but today we are discussing for the world. Today we are discussing to take these examples so that people in other countries, other geographies, they also can learn. And that's why let's spend some more time. I also see some of the questions that has come. So first, let's take some of the questions from the participants, ma'am. One has come to you, is always pleasure to listen to you, Vinita ji. I just wanted to ask about the ministry's plan to revise the guideline for hemoglobinopathies.
So yes, it is like we recently are going to have a meeting where we are planning to revise the guidelines a little bit, though it is impacted guidelines, but we are planning. And if you see the new guidelines which has come up for sickle cell disease itself, you will find new changes into that. So new technologies are also being added, and the convergence models are also being added into that.
Very good. And when I see government partnership for the gene therapy, last week when we got first indigenous made in India CAR-T therapy for one of the blood cancer, I think time is not too long when we can see this disease being cured by some solution which we can actually develop in country. So I think these are very kind of forward-looking step that government has taken to work on, and that too from a Ministry of Tribal Affairs, for example. I don't think any other country will see such line ministry working for a very specific health condition. So I think it's a lot of credit goes to the Minister of Tribal Affairs, each one of you who have been working with this. But I think the leadership that Honorable Minister is showing for this program has really paved way for this. And I think now it's also a time for us from India to take these examples out, because sometime it may also bring some examples back to us from some other countries. So now now I also see a few more participants joining. So I just want some of, for example, I see Dr. Suman Jain ma'am. Those who have not introduced yourself, this is time for you just to say a line about you and from which part of the country you come to, so that we all know that who all are on the call.
Good afternoon. I'm Dr. Suman Jain, and I'm working with the Thalassemia Sickle Cell Society for last 25 years. It is in Hyderabad, and we are really working, and I'm very grateful to Prabhat, and because he has come to our society, and Dr. Vinita Srivastava also. And we are working I will say it is a holistic approach what we are doing. We are giving the treatment and also on the prevention part and antenatal screening. And I really want, and government is really supporting us. But as it is a state-wise approach, health is a state issue. So all the states are not so, strong enough to work together, and collaboration with the NGOs is very, very important, which is needed. And I want if the central government can push more towards the state, who can work along with the NGOs and can come to some really good approach to prevent. And this is a preventable disorder which can easily be prevented. If we don't prevent, we are spending so much money, what Vinita Srivastava madam has already shown. So as it is a preventable disorder, we should work towards prevention.
Thank you so much, Dr. Suman. I also see hand raised from Anubha. Anubha, if you can just speak, please. And then I see Subhaji. Yeah.
Hi, Prabhat. Can you hear me?
Very loud and clear. Go ahead.
Oh my God, I think it was too loud. Okay, no. So good afternoon, and of course I'm really overwhelmed to see both Vinita ji and Prabhat, and of course I have known them for a long time, and it's great to see you. And this is a great platform. I wanted to also congratulate GANSID and especially Landray for this wonderful initiative. I think we badly needed something like this, where all the disorders, hemoglobinopathies can come together on one platform. So I'll be very quick about what I want to say. So for the benefit of everybody, I'm Anubha Taneja. I'm representing Thalassemia Patients Advocacy Group, which works under Thalassemia India. We basically assist Thalassemia India. Thalassemia India is our parent body, and we work to protect the overall interests of thalassemics in India. So basically, we go much beyond the medical aspects. We try to touch the psychological. Madam spoke about the emotional and the mental aspect. We work very closely with the government as much as we can to work on policies that are conducive for thalassemia. So today, I was very happy to see, like Prabhat said, that so many times this word patient bodies was used by ma'am. Then the word partnership was used a lot, and it's really overwhelming. So a couple of things, more than questions, I think these are observations. And what I really want to say is that we would love to see increasing convergence between sickle cell and thalassemia and hemophilia. So this will also optimize resources, because if you are having an eradication plan, for instance, for sickle cell, then I don't see any reason, unless it's a technical reason which we are not aware of. I don't see any reason why thalassemia should not be in the same basket. Then when you spoke about the Coal India project again, it's a wonderful project, and we have been speaking to DGHS for looking at the similar format for other aspects of thalassemia, like blood screening and also treatment beyond stem cells. For instance, tomorrow we'll have CRISPR. So if this PPP model can also be considered for other aspects, even prevention for that matter, if companies, and we have already written to DGHS that they should look at this model for NAT screening, they should look at this model for prevention of thalassemia, look at public sector undertakings. For instance, you have coal, you also have IOCL, you have many public sectors who might want to jump into this. So that was one point that I wanted to make. Then revision of guidelines, Vinita ji has already spoken about. And I would also like to say, and this is my last comment, that I think patient participation in terms of thalassemia needs to increase much more, in the sense that there needs to be, I think, Vinita ji, an ongoing channel of communication between patients and the government. Instead of, we write representation, we get a response. For instance, TPAG is a special invitee to DGHS, a standing invitee. So I think that's one of the very good ways, and we are working closely with DGHS on blood law and so on and so forth. So I think if some permanent mechanism like this one can be considered by you, I don't know, in MOTA or in MOH, to have a patient body. And when I say patient body, I mean patients. So yeah, these were my limited points, and over to you.
Thank you, Anubha. I think we will respond to this, but thank you, as I said, loud and clear. It's very important to be loud with your voice, and you have always been a very strong advocate for that. And all the points are, I think, a forward-looking point, and I think Vinita ji will respond. Before that, I know Shobha ji also has to leave for some urgent thing, and I also see her hands raised. So Shobha ji, if you can also put your comment, suggestion, observation, please go ahead.
Well, is no queries, no questions, but just the comments, As I was hearing you and then later Madam Vinita ji, that both of you have stressed on the collaborations, and which later on, Suman Jain ji has also talked about NGOs, and Anubha has also strengthened that point, So my memories went back to 2012 and 13, where this all that, I would say, market as a movement, which started at the Ministry of Health. I won't say that work was not going on there. But then, from that year onwards, when Madam was there in the ministry, there were certain things which happened. I recollect in 1970s, I had to travel to London to meet Dr. Weatherall to see a book, So this was my dream come true when I sat down with Madam in the ministry and with Jay sir and all that, and we talked about that, well, a book has to be printed, which is the national guidelines. And then during her time only, the national policy document was also drafted. And the one thing which I want to mention here, because Prabhat, you said that this is an opportunity to showcase our strengths also, what work has been done in India. We all know that it's a hugely populated country. Numbers of patients are more than the biggest, and India is labeled as the, thalassemia capital and all that, which really pains us. Because as Vinita Madam has said, that the patients and the parents, who go through all these challenges and all that, they are the people who suffer the most. So what I want to add here is that the Thalassemia Bal Seva Yojana, when it was started in the health ministry, with all credit goes to Madam. I remember those days, And when I was in Calcutta for that meeting, and there was one slide talking about Thalassemics India, and the Coal India, one of the very high big officials said that, well, go to the other slide. I said, let me speak about our society. He says, no, we have done the homework. So it is the trust, which you have mentioned also in your presentation, that also what comment I want to make here is, apart from these, that a lot of work has come up from the Ministry of Health during her time. We have worked very closely with you, and I know that how passionate you are also about that. I still remember the Mumbai Jain, institution where we all came for education and all that. Education will never stop. This is another opportunity to learn and learn and more. I think now is the time. Our government is so sensitive about hemoglobinopathies, and as all the patient care bodies says that, well, and we are very proud and we feel very happy that sickle cell has been taken care of. That it's time now that the remaining, the thalassemia should also be incorporated in that, so that we can move ahead in a very modified and a very structured manner to achieve what we dream of, the zero burst of thalassemia. I don't know whether it's possible, but at least we all can try to control the future bursts of thalassemia children. Lastly, I would just say, apart from this, that, well, we the patient care and the parent care giving bodies, we really look forward to work with GANSID Congress, and whatever responsibility and participation that they expect from us, from the caregiving giving bodies of India, we'll be more than happy to cooperate and to join them, because we want to see the results happening in our country as well. Thank you very much for giving me this opportunity, Madam and Prabhat ji. I'm really indebted. Thank you.
Thank you, ma'am. Thank you. And I think listening to all of you, in fact, what Anubha said and what Shobha ji you said, I think maybe today, 21st of October, we have seen a lot of collaboration, between government and in that particular disease area. For example, thalassemia and government, thalassemia among thalassemia groups, hemophilia and government, sickle cell disease and government. And I think when I said that, now this collaboration has to move beyond border and beyond sector, I think there is a acute need to kind of come thalassemia, sickle cell disease, and hemophilia, all because each one of you bring a lot of expertise, lot of know-how. And I think a platform like this, and that's why since Landre has started this whole forum of GANSID, I think she has done a commendable work of thinking that the problems are kind of same, solutions could be very similar, and that's why there is no need to kind of address them differently. Even when government says that we will eradicate sickle cell disease mission, sickle cell disease, they cannot leave thalassemia, because once the screening happens on ground, no way in that blood test, before a test, you cannot remove thalassemia patients actually. So I think there is a lot needs to be done, and I think that will happen when in our country, when we also do workshops or consultation. Like today, we see a lot of cross-sectoral people joining from different disease area. I think that is a need. I also see a hand raised from ICMR, ma'am. If you can just speak, please.
Firstly, I want to congratulate both of you for a wonderful presentation. And myself, Dr. Ravindra, working as a scientist in ICMR, National Institute of Research in Tribal Health, and Jabalpur. Our institute is mainly focused on and only institute in India which works on the health issues of the tribes, which is a particularly one and tribe groups. So sickle cell disease, which is a mostly tribal disease and most commonly formed in tribes. So I am involved in the sickle cell disease mission, and closely work with the Vinita madam for this project. And currently I am involved in capacity building of the different stakeholders and health sector groups for the sickle cell disease screening, treatment, and management guidelines. I hope in the near future we will, with different collaborative works, as discussed in today's presentation, we hope that we could initiate a big and achieve a goal. Thank you.
Yeah. Thank you. Sorry, I got some audio issue for a second. So thank you for your comment, sir. You can hear me, right? All of you can hear me?
Yes, yes, yes. Yes, sir.
Thank you. Now, I also see some representatives from sickle cell disease, from NASCO and then from Rajasthan. So any comment, any suggestion, any words from sickle cell disease community?
Yes, sir. Thank you so much for giving this opportunity. This is a really very great pleasure that Government of India has initiated Sickle Cell Mission 2047, and no doubt our Vinita ma'am has taken more efforts to execute this, or this is possible because of her. So in this forum, I must say big thanks to her. And as the announcement done that 0 to 40 years, every tribal person would be going to be screened for sickle cell disease in next 2 to 3 years. This is a very big opportunity to catch the sickle cell patient and early diagnosed, and we can prevent them. So, as a sickle cell community of India, we are just waiting for the implementation of this mission as early as possible. So, I am taking the opportunity of this forum and requesting to the Vinita ma'am to please uh, please take this request in your ministry that as early as possible this screening should be start in various states where the people are waiting for screening. Thank you so much. Thank you so much for all of.
Thank you, Gautamji. And as we discussed that, this is an ongoing process. We need a lot of trust, a lot of respect to each other, a lot of trust on each other. And I think this is a journey. And I think a lot to learn from, let's say, thalassemia, a lot to learn from hemophilia, and also to kind of share some of the very good experiences that as a sickle cell disease groups you all have with the two groups. And together, I'm sure, as I said, that these are conditions which are very similar. You cannot actually exclude one at the cost of other. The way the whole setup and the whole function and program is structured. I see Dr. Suman Jain's hand raised. Ma'am, do you have any point you want to comment?
I just wanted to add, the Rotarians were involved in eradication of polio. Yeah. So I'm able to hear. You are able to hear me? Yes. So recently one Rotary Club has approached us from Mumbai. They want to start a center like that, and especially the eradication thing also they want to work. And the Rotarian has got a branch all over India. Can we collaborate with them, and in the field of prevention? They can they can play a very big role in a case of prevention. That is what I wanted to put this thing.
So very good suggestion. I hand this over to Vinita ma'am, and I'm sure, and there are many other points that also has come. So Vinita ji, if you can respond and comment on those points from your side, please.
Absolutely correct. And I start from Anubha, that she said that it is an important task that we have to basically come up with the patient's proactive measures in the ministry itself. And it's important that I will also admire that what she has said. That's one thing. Second thing, which was talked about the prevention. It is important that the prevention should be taken up. Prevention is very important, and it cannot be taken up only by the ministry, but it is all by the patient organizations. Yes, Rotary is a very good option, what we had in polio. They were a very good initiative which was taken for the polio. Yes, we can involve these Lion clubs and Rotary clubs that we are also thinking of, that we need to, apart from getting the ministries. We also have joined hands with Eco India that for the training part, and like Vicky also, they have been joining hands with us. So it's not only one thing but it's a good suggestion, Suman, that we are also contacting the Rotarians and Lions people, and these Leos are also contributing. So what happened when I went to the Ministry of Youth Affairs, I went for the youth clubs. That was something very interesting, and there I met the Leo people also. So these two things have been joining hands there also. So youth clubs and the Leo clubs, they are not different as some people from the youth clubs are the part of Leo clubs, and then some are from the Leo clubs are in the youth clubs. So all these people are being taken care of. And you said, it's a good suggestion. We are into it that we will be joining hands with everybody. Thank you. Another thing which was important is patients should be a part of every policy. So if you see the government sickle cell mission, the operational guidelines which came up in Ministry of Health, that was different. But the guidelines which came in Ministry of Tribal Affairs was that every patient group was connected. What Dongre has said is equally important, because Dongre said that now it's a time that the screening should start. They have been working with us in so many good things. I mean, I should thank Dongre. When I was going for my disability thing, I still remember he said, Madam, let's do it from 1 year to 3 years. All these people, I'm saying I'm blessed with these people. So this was a time when we started with small things, but now you can see that bigger things has been happening. So the screening will also take part, where we will involve everybody for this purpose.
So now we are just a minute away from our time that has been given. But before we end, any last question any of you have, if you can just briefly raise your hand or just speak up. Okay, if there is no question, I think we will get a kind of a small survey or a feedback link on now on your screen. But before that, I just wanted to thank each one of you. Each one of you, today is a Saturday festival day, but taking 1.5 hours out on Saturday afternoon, this shows the intent. And since myself and Vinita ji know most of you on this platform, and you have always been very passionate. But as we said that maybe today it's a first opportunity where we all came together as different hemoglobinopathy. Let's continue taking these discussions forward, and I'm sure something good will happen, and also document some of the good things that has happened in our country, so that we also share these best practices for other markets. I got a message from one of the other country, and they said that we are attending that session, but I actually wanted to attend India session, because the way India is dealing with some of the challenges. So I'm sure there will be a forum when you all can share a lot of good examples, and also a huge thanks to Landre for, first of all, creating this platform of GANSID, where I think so many experts, when I see the list globally, I think a lot of people are together, and not only people who are speaking, but also everybody who is here, whether as a participant or a speaker. I think we all enjoyed this 1.5 hour conversation. Special thanks to you, Vinita ji, for your time. I think you have been a very, very busy person always, but we also took your time on a Saturday afternoon, and I think let's continue this journey. As you said.
Prabhat, this is the first step, and I want everybody to join in future, because we will be having this Asia part has to be really come forward for new strategies which will work across. That is very important. So everybody has to join hands. Let's put our hands together. Say yes, we will do. And GANSID has taken up, thanks to Landry, that she organized such meeting. And the best part is that everybody from thalassemia, for sickle, or for hemophilia, everybody has to join hands and come forward for new strategies, which will help the worldwide. Thank you so much.
Thank you. And for all of you, you will see a kind of a poll on your screen. Since you have given 90 minutes, now please spend 1 minute, 2 minutes, whatever you take. But please do put your view on this. There are some 5 questions, 2 very easy. Just you have to put a dot mark, and there are 3 where you can put your comments. This is extremely important, because this will help GANSID and also to us, both of us, to see that how you found the session, what needs to be done better next time when we meet. So please feel free to give a very honest and genuine feedback on your screen. And everybody, I request that don't leave unless you put your feedback. We don't have a mechanism कि हम पकड़ सकते हैं बिना feedback दिए जाने नहीं देंगे, but I know you all will do it for us, because this is important, so that we as a group become more effective next time.
So I'm unable to see that feedback.
Poll on your screen, you cannot see?
Yeah. I can't.
I have submitted.
Actually, just I submitted when I saw the session was, and that one poll only I dotted and submitted. I missed the rest of the question actually, which I couldn't saw in my screen. I am using my mobile. So
okay. No problem.
I think it's
we will
gone.
see that.
It's gone from my side.
Okay, no problem. If there could be a mechanism where some link or something can be shared.
Yeah.
But I think with this, let's close it because we are already 3 minutes above time. So thank you so much and wish you all a very happy Durga Puja, Navratra, whatever you are celebrating in your state. And we will meet soon. Thank you so much.
Wish you same, sir.
Yes.
Thank you.
So on behalf of GANSID, I'd just like to thank everybody who participated, the panelists and the hosts. And thank you for everyone who completed the poll. And yeah, we can end the webinar now.
Thank you. Thank you so much. Bye.